The most recent study that I can think of was 2017. There was a meta-analysis that reported a 52.4% decrease in sperm counts among men in Western countries.
Welcome to the Super Daddy Club, to all our guests and audience. Today, we're thrilled to welcome April Rutter, co-founder and COO of Hera Fertility, and Thiv Paramsothy, co-founder and CEO. April brings over 20 years of experience in the field, having expanded access to care and led industry advancement. As chair of the Association of Reproductive Managers, she continues to drive progress in reproductive medicine. Thiv, an experienced entrepreneur in digital health, is revolutionizing the field with Hera's groundbreaking at-home male fertility testing kits, making treatment more accessible and saving valuable time. Together, they are reshaping the future of fertility care with innovation and expertise. Thiv, April, welcome to Super Daddy Club.
Thank you for having us.
Yeah, we're excited.
Yeah, absolutely. This topic is so interesting because it's very easy to go down the rabbit hole and just keep going. And where does it stop? Who knows? But that's what I found myself doing. So I read through all the papers that you sent me and some extra stuff, and it was just also captivating.
Yeah.
I wanted to know, just to get us started, if you could take us through the journey of building Hera Fertility and also tell us about the problem that you identified to get you started on this journey.
For sure. That's literally what happened to me after seeing a lot of my friends struggle and them sharing their journey and then learning more about male infertility. I realized it's actually much more common than you think. Everyone talks about just general infertility becoming a big problem right now, of 1 in 6 couples running into it and having this issue. But if you dig deeper, you find out a lot of times it's actually the guys are contributing to that infertility diagnosis about 50% of the time, some sort of male factor.
Mm-hmm.
So like yourself, I was doing a lot of research on my own and I started to get scared and realized that this is becoming a huge problem. And there isn't really good solutions out there for guys to not only learn about, but address it properly. And so that journey took me to actually meeting April and got to understand the system better and then realize there's a huge opportunity. April, I don't know, what was your experience on that?
I come from the clinic side. So I was running an IVF clinic for 21 years. And you have the female that comes in, schedules the appointment. Her male partner comes with her and we get a semen analysis. But what you don't realize is she's had a journey that has spanned over a year before that. So she's been doing all of this stuff, trying to figure out why she's not able to get pregnant, but no one's even looked at him yet. So when we realized that we wanted people to get tested earlier and we wanted to increase access for them to do that, we started on the female side of things, offering diagnostic testing for them, but every patient was offered a semen analysis for their partner and only 2% of them actually did it. So we realized that men are just being left out of the journey. And when we started talking to men, we realized that they didn't know they were being left out of the journey. A lot of them would have happily gotten tested, but no one's bringing them into that process. So we want to really raise awareness and get men more into this whole journey so that it really can be the couple going through this.
Was that a bit of a missed opportunity to, especially clinically, to not focus from the onset on both sides? Or is it just a part of the general culture where when it comes to reproduction in general, men are not really, culturally, we've always been shunned from these areas?
I think for me, what I realized is in my experience, the clinics are able to offer a couple of different ways to help women get pregnant. And because we're trying to get her pregnant, she is the focus. Like she is the one we're working on. So what ends up happening is because we can get around any issues we find for him, if we need to go directly to a procedure that extracts the sperm from testicular tissue, you can do that. So there just didn't seem to be a lot of focus on him because it's so easy to bypass and get to the sperm if we do find a problem. I say it's easy. It's not pleasant, but it is something that's possible. And so I just think that the focus has been so much on her. And now we're really seeing the industry taking notice that we need to put more emphasis on male fertility and understanding how they're contributing to this. Because like they've said, they are contributing to 50% of the infertility cases. So that's not a small number.
At Super Daddy Club, we talk a lot about stress, health, and staying present, especially as parents. That's why we're proud to partner with Breath, a wearable device that uses vibration-guided breathwork to calm your nervous system, train your focus, and help you reset, anytime, anywhere. Visit us at superdaddyclub.ca to get an exclusive discount, because your peace of mind is worth breathing for. No, not at all. And to bring it back to what you're talking about, Thiv, people just do not talk about this because they're experiencing miscarriages essentially and just failed attempt after failed attempts. And if you can maybe help us understand the prevalence of it more, but it is just not talked about in society.
Yeah.
And so to begin to have those conversations about the loss aspect and then the reproduction aspect is so important. For some of my friends who have undergone miscarriages, it literally ended up, it didn't work out. And that was it. But
no, and it's an important point that, a lot of people just don't talk about in general of the whole journey. I think more and more is coming out of the shadows and some people are talking about, but still it's a tough conversation to have. And I think it's important too, because more people are having this issue for a variety of reasons. And so not only in like infertility, but yeah, as you mentioned, like reoccurring pregnancy loss is an issue that we should be talking about and providing good solutions. So as I mentioned, like now 1 in 6, even the CDC says 1 in 5 are having infertility issues. So that's at a point where they're having difficulty. And by the definition, it's like after a year or 6 months if you're over 35 of trying for that time and not being successful. So that many couples are having this issue of like 1 in 5 is pretty crazy when you think about it. And then to your point, if there's now more and more who are having this issue of when they do get pregnant, they may lose it. And so I think what's important right now, especially as we get more and more of these new advances in reproductive health and opportunities to and solutions there, we need something that addresses all the different aspects. And what we've landed on is, can we focus on the men's side? Because for all these things that we've talked about, men play a big role, even with reoccurring pregnancy loss and those outcomes. And we should develop something that really speaks to men and makes them the central focus, because at the end of the day, it's going to help the women hopefully get pregnant.
When we're talking about it from a crisis standpoint, are we talking about just the side of male infertility, or is it infertility as a whole when we look at it globally that is presenting as a crisis? If you can expand on that.
I think for me, I feel like, there's so many crises happening right now, and infertility is one of them. But when you dig deeper into the men's side, it's not talked about a lot, and sperm count and quality has been dropping for decades and continues to get worse. And we really need to address it. And I haven't seen anyone really shouting about it and talking about it. And for us, we feel like that's so important. We should be the ones focusing on that because it's become a crisis. And without it, like sperm plays half the role here. And without it, society could crumble. So I think it's really important for us to understand what's going on, make sure men are being proactive, and then see if we can help them address it and improve their situation.
To understand the importance of why this is being looked at, the most recent study that I can think of was 2017. There was a meta-analysis that reported a 52.4% decrease in sperm counts among men in Western countries, looking at 1973 to 2011, I believe. So, I mean, this is a fairly big problem that is really causing, driving this to be such a huge issue with reproduction that now we see 1 in 5 couples that are struggling, or 1 in 6. It's somewhere in between there right now. So I do think that it's time that we need to focus on men's sperm health for so many more reasons. I mean, obviously, you need healthy sperm to create life. But, also there are so many indicators that you can learn about just overall health through sperm health. So it's really important for a lot of different reasons that we really start taking sperm health seriously.
Yeah, and talking about the indicators, there's so many causes. And when you look at the pathophysiology of it too, so many disease processes that lead to infertility, it is just incredible how much education is really needed around this. I kept thinking to myself, maybe in sex education classes, they need to touch base on this to some degree, right?
Yeah, I think
100%.
so.
Yeah.
I think so. Yeah, because a lot of people
Not
just
to
don't
make it more
understand.
complicated.
Yeah, I know. I think it's just like a lot of people just don't understand all of this. And I think as people are trying to have kids later in life, I think it's important to understand to be prepared and be proactive. But yeah, it's been, for me, really eye-opening understanding how much we know about sperm health and how much we don't. But like knowing about these different parameters, count, motility, morphology, you can really understand a lot about someone's fertility and overall health. And so I think it's, once people understand it, I think they start getting in tune to it, and they're open to doing the test and learning more.
Especially starting to tackle it early on. Can we go through some of the causes that people should be aware of infertility?
Yeah. So you end up having lifestyle factors, environmental factors, and medical conditions. So within those, a lot of them cross over to being a factor for men and for women. Things like smoking, alcohol consumption, age is a factor. So, really health, like overall health, environmental factors like exposures to toxins, heat, and then also, medical conditions, such as PCOS for women, endometriosis, low testosterone levels for men, things like that. And then, there will be some things like obesity, things like that, that really, can lead to severe infertility issues.
Yeah. Just to add on that, I think that's a good list of all the different things that could be impacting both parties in this fertility journey. And remember, on the women's side, there's a limited amount of eggs that they have. And so, age and all these other things could impact the eggs quality and quantity. And I think that's an important thing to think through. But PCOS, endometriosis, like April was saying, these conditions have really disrupted or caused some issues for people to hopefully successfully get pregnant, where they disrupt that. And then on the men's side, I think all those factors play a role, but if you have to rank them, though, I believe weight has a huge impact here. More and more of these issues are tied to, or low counts or any of these conditions are due to, metabolic issues. And then there's some lifestyle choices like mentioned there. And it's just being aware of what's going on. Now with guys, what's important here and what we try to educate people on is that if you have issues like that, or if you have lifestyles that really is disrupting you to have that, to be able to be successful, you can change that and you could see an improvement in 3 to 6 months. And that's what we really focus on. So we get patients who, it's an all clear, everything looks good. But then we also get patients who have issues, and we educate them that these are the lifestyle things you need to think through. Here are the medications even you need to think through that you should be taking or changing. There's a lot of things that we can tell them about, but what's important is like, we want to make sure and encourage that they're changing their behavior. So if weight is an issue, are they exercising? Are they eating better? Those things we try to encourage. And then hopefully if we retest them, we see an improvement in those numbers.
I was reading too about the classification of them, where they're classified as treatable, uncorrectable, or untreatable. And so by addressing the environmental factors, which we probably have control over to some degree, you're eliminating a significant percentage of what could be causing the issue in the first place. And
Exactly.
how much is time a factor in all of this? You talk about, for example, by the time somebody's presenting at the clinic for the woman, it's probably a year-long journey already.
It's interesting because the diagnosis for infertility has time as its core component, which April and I chat about a lot. Is like, I don't think it's fair. I think of all conditions, like, it's kind of silly to think that that's supposed to be the definitive way to know if you have infertility or not. So based off the definition, it's like if you've been trying for a year or 6 months if you're over 35, then you are diagnosed with infertility and you are now open to other kind of treatments, essentially. And so time is so important here in different ways, especially on the women's side. As I mentioned, now people are having kids later. It's a different scenarios because of that. And it's resulted in being a little bit harder for someone to be successful getting pregnant. And then, time could also be considered in a different way too, of like how long people are waiting to get tested, or guys are not being proactive when they should be. So I look at time in a few different ways there. And I think what we're trying to say is, why are we waiting that 1 year? We should be trying to be ahead of the curve here, especially if you find out you have issues.
I think it's important to note that, yes, the definition of infertility does put time in there, but you don't have to wait in order to be diagnosed for infertility. You can look at your fertility potential before you wait that long. And I think that's where the misunderstanding is happening. People are waiting that year or 6 months before they go to see, can I get tested to see if there's anything wrong? Whereas it really should be, hey, I think I'm ready. Maybe we should talk about, should we have a baby? Go get tested then. Let's just see if everything's going to be smooth, make sure that there's nothing going on. And that way you haven't wasted any time. You know exactly what you're dealing with. You have all the information. I really think that it's important to be proactive, take a more proactive approach towards fertility than being reactive.
Mm-hmm. I was actually thinking about it even from the prevention side, because if you can start changing your behavior early on, there's so many medication that affect fertility. I had that question for later about ADHD medication and testosterone supplement and all of these things that people are taking, even, testosterone I don't know if people...
TRT, yeah.
Yeah, steroids for
Yeah.
young people who are working out. All these things have an impact on that. And maybe these are conversations that we can be having early on as well.
Especially those things, it's shocking because now more and more people are taking them and a lot of times not aware of the full implications. So there are patients who, they go on these kind of now TRT treatments, testosterone replacement therapies, and then realize that maybe they want to have children a couple years after and realize they can't, and they have a whole issues there. And it's really hard to fix that afterwards. So I think it's important to know the facts about all this, especially if you're taking those kind of medications or even other medications like you were mentioning there, even hair loss medications. There's a whole list that we have, and there's more and more literature coming out. We need to be aware of it so that we can make a good judgment and decide. And there's other ways around it. Like in April, maybe you can dig deeper into this, but you could freeze your sperm if you want to have a backup and proceed with taking those treatments as a way to think through it. But it's all about planning ahead, testing yourself, understanding the implications, and going from there.
I think it's also, this is going to go back to the providers that are giving out those types of medication, just really educating men on how this is going to affect their reproduction. I know a lot of people are getting testosterone from all kinds of different programs, and some of them aren't doing a great job of explaining how that affects the sperm count and the sperm health in general. Sometimes that can bounce back, but that's not always the case. So we really do need to make sure that we're giving the education, we're making sure that men know what is affecting their sperm health and how to avoid that. And like they've said, it's a medication that you absolutely need, we can go ahead and freeze sperm for the future so that as it may be declining your sperm production, you still have this other way that you'd be able to move forward and have the family that you want.
Mm-hmm. Can you take us through the evolution of the technology with fertility testing itself? Even more importantly, how do I know I got a problem even to begin with?
So, I mean, there are some things that can kind of just give you like a red flag to let you know, hey, maybe I should get tested. Maybe I need something to tell me where I'm at. So I think some of those things are going to be, just like erectile dysfunction, trying to have a child and not being able to get that positive pregnancy test, things like that, that'll just kind of help you understand that, maybe you need to get tested. But a semen analysis is basically made up of a few main parts. So what we're looking at is we're looking at how much sperm, so the total number of sperm that is in the sample, and then how many of them are moving. So when we're talking about motility, there are a couple of different things because you could be moving, but not moving in the right direction. So
Yeah.
Mhm.
I like to always think visually as like, are they bumping into each other and they're special, like it's not working? Or are they going in the right direction? Is kind of that motility angle.
I've never thought about it from the perspective of direction.
yeah, I mean,
Yeah.
if they're moving and they're just going in circles, they're not getting anywhere. So we
Okay.
need the movement to be forward. So, really looking at the way that the sperm moves, that would be the motility aspect. And then morphology is more of the shape of the sperm. Do they have normally shaped heads and tails? Are there two heads? There's all kinds of different ways that sperm can look. And so that morphology is really going to tell you more about what the actual sperm looks like and how many of those are normal looking sperm.
And then I was just going to add is that these are important parameters to think through. And that's what the semen analysis uncovers. And then you get a trained specialist who's able to understand the results and tell you your count and motility and morphology is within a good range. And if not, then what are your options from there? And kind of going into a little bit about what we're doing at Hera, we saw that and we saw that we need to change that. And how can we get more information about your sperm health so we can really understand what's going on? And can you do this in a place where you could comfortably do it at home? Right now, the testing rates aren't at the level it should be compared to what women do and the amount of tests they do. And what we learned talking to more and more men, and we see it now more and more with our tests being available, is doing it at home and providing that collection at home is a game changer. People are willing to do that. They lowers the barrier and they're able to provide that sample. And then from there, we want to really uncover everything. So there's no stone unturned and we understand exactly what's going on with this person's fertility.
Mhm.
So that's on the guy side. We're happy to go into on the women's side.
Please,
There's
yeah.
way more tests that they have to go through, I feel like,
Way more.
which is crazy because the guys, literally, we're just providing a sample and we can learn a lot from there, especially with what we're doing. But on the women's side, it's so fascinating the battery of tests that they go through. And April, when she was at her clinic, I witnessed like just talking to her and the different tests that they had to do is pretty crazy.
Can you take us through a little bit of that, April, just to help us
Sure.
understand the woman's journey?
Usually the first step is we're going to get some kind of blood work. So that blood work is going to be hormone testing, endocrine testing, just to kind of see how the body is working. Is there anything that we should be worried about and how everything is being processed there? So that's usually the first step. Then we can do things like a transvaginal ultrasound just to look at the uterus, make sure there's no, polyps or fibroids or anything that would be affecting the inside of the uterus that would make it difficult for pregnancy to take place or maybe could be causing like some kind of recurrent pregnancy loss. And making sure that the ovaries look normal. There isn't anything to be concerned with there. Then there is the HSG, or a hysterosalpingogram. So that is basically a test to see if the tubes are open. It can be done with an ultrasound through a saline sonogram, or it can be done with an X-ray. But it's just to see if the tubes are open and there's nothing blocking that egg from getting into the uterus. The tube's very important. That's where the egg meets the sperm, and that's where everything gets started. So we want to make sure that we have healthy tubes. And then always wanting to, make sure the woman herself is healthy. So looking at those lifestyle factors, things like that. We can also do what's called a laparoscopy or a hysteroscopy. Both are surgical procedures. A hysteroscopy is basically taking a scope into the uterus and being able to really get an in-depth look at everything. You can take a biopsy and everything through that. With a laparoscopy, it would be a surgical procedure that would go take a look at the outside of the structure. So you're going in through the belly to really take a look at the outside of the uterus and the ovaries and everything, making sure that there aren't adhesions or endometriosis or anything like that that would need to be taken care of. So when we're talking about the fertility testing for women, we're talking about a lot of procedures. Where with men, it's a semen analysis. And if that's bad, then we might need to do some blood work. So yeah, I mean, there are procedures that, depending on what the semen analysis tells us, we may need to do in order to correct things or get some more information on what might be going on sperm health wise. But for women, they really do go through a lot. The process for them to go through a diagnostic workup can be about 3 months.
That time factor again.
Yeah.
By the time she's done dealing with it, how much time has passed? With that, what are some of the big barriers? Thiv, you said that being able to test at home is a game changer. My thinking is if we make testing easier, more accessible, then we can prevent the woman going through a lot of that stuff. Is that the thinking?
Yeah. What we found is that because of the discrepancy of when the men and the women are starting their journey and who's getting tested for what and all that, we feel like it's super important to have the guy tested right away at the beginning. And that way we can make sure we know what's going on for both parties. Because the worst situation, sometimes women are put through a bunch of different treatments and the man has not been tested. You could try as much as you can, but if there's something wrong with the guy, it's not going to work. And that's the unfortunate fact. There's so many stories, and probably April knows even more, like, and heard them all, of people just going through that. And then a year or two later, at the end of doing everything, they finally get the guy tested and realize, oh, that's the root of the problem. So we want to make it more accessible and make it so that there's no issues around this. It's a simple test. You do it in the comfort of your home, and you can, especially with what we're doing, you can uncover everything that you need to understand. So we can make sure we're very proactive. We know what we're getting ourselves into. It's really shifting the paradigm, like the whole concept, because it's been very reactive to now being proactive. But we're seeing stories now. We get patients who message us and say thank you because they would, if they didn't, they would have gone down the typical path. But instead, they were able to be proactive and change their lifestyle, actually go do a procedure or a treatment that will now is helping them, and hopefully they're getting pregnant. We hear those. I was telling April the other day, I got a text message from someone saying thank you because they did our test and were able to uncover something they didn't know.
Can you tell us more about your test specifically? Because essentially before, if I wanted to get testing done, I have to go into the clinic.
Yeah. You have to go into the clinic. You have to go there. You're given a cup, usually a little similar to your urine cup, and say, hey, use the bathroom over there. And I know there's some places that have collection rooms. Some places say, hey, just use the bathroom around the corner. And people just have to do it because they need the sample. What we've done is that we've taken that away, and now instead patients can be given a test kit where they can provide their sample at home and get the same quality and even better a lot of times than what they would do at the clinic. And so the way that it works is that they provide the sample at home, they ship it to our lab. Our lab does a full analysis of it and then gives a clear report of what kind of results you have. And we spell it out. And the good thing is that we try to provide recommendations and make the results clear, so very user friendly, so that it's not just you staring at it and going, I don't know what this count means, but you can understand it. And that's really helped a lot because now they feel comfortable, they can understand what it is, and they know what they need to do next. And we're there to help them. Because the worst thing is that we convince this person and they got the test and then they find out they have issues and then they're left to their own devices.
Mm-hmm.
I think our test is important, but I wanted to make sure that's clear that we're there to support them throughout the whole journey and then hopefully see that improvement so they have a better shot at getting a family.
Yeah, I thought that was really important, connecting the innovation itself to, or at least making a part of the innovation, connecting people with medical specialists who can talk about those specific issues. Again, going back to the fact that there's so many confounding factors that can cause infertility, from the pathophysiology side to the environmental factors and everything, that doctors are busy. You're going into your clinic for this particular issue, they're going to deal with that particular issue. I remember with my ADHD, that was essentially, there was that kind of tunnel vision that occurred where more could have been addressed, but it just wasn't. So I thought that was a very brilliant thing to do on you guys' part, if I can just mention that.
Appreciate that. And I think that's the most important part here is how do we get people in general feel comfortable to get that access to care? And now being at home, like this should be a no-brainer. There's no excuses around it. You can get in front of your doctor or go on our website. So I want to remove all those barriers that we kept hearing about. And, I know because, as someone who was born and raised in Canada, there's a lot of access issues even now. And so we want to open it up so that it makes it easier for them to get the information that they need.
Mm-hmm. And talking about access, it's probably even more difficult in the United States. Sometimes we Canadians don't think about it, but
yeah,
probably more complicated on you guys' side of town.
Yeah, no, and it's been an eye-opening experience. I know, like, especially what we're seeing a lot of interest in these rural communities where they have a hard time finding the access to something like a semen analysis test because it's not like it's going to be in every lab companies. You're going to have it available there where you would go get your blood drawn. And so this is just an easy way for those places to now have access and have the patients and those providers have access to the information that they need. A lot of people are trying to have kids, so can we now make it so that it's available? They don't have to drive, 2-3 hours sometimes to the nearest place.
Mm-hmm. Yeah, very important to address. Now, on the prevention side of things, again, once you get this information at home, even let's say early on, what can you start doing to boost male fertility? I thought that was a very important aspect of the conversation, that maybe being able to test at home can bring about more encouragement for people to actually start dealing with this a year ahead.
Yeah, no, it's a great question. I think there's a lot that could be done and more research is coming out about different options. So lifestyle-wise, I think there's fundamentally, you got to start exercising more. You got to eat healthier, especially avoid ultra-processed foods, and then not drinking alcohol, not doing marijuana, smoking, all of those, basically every vice out there. I would stop doing those because there's more and more literature about how they impact the sperm health. And then definitely reviewing your medications that may be impeding or causing some issues there. There's supplements that have different levels of research behind it on the effectiveness, but there's some supplements you could take. We actually sell some, but one definitely that I would recommend everyone to do is like CoQ10 and multivitamins. Those ones are really good and have shown more and more evidence that it's effective. And so those supplements are a good way to just add on and take on a daily basis. Yeah, April, am I missing any other ones?
I mean, the only ones that I would say are also, easily done to be able to make changes on your own would be really watching your sleep. Sleep is so important to help stress reduction as well. So stress, it's always important. No one wants to be stressed out, but it's been linked to reduced sperm quality. So stress really is an important factor that we do have to talk about a little bit more than what's currently being talked about.
Yeah.
Mm-hmm. And when we're talking about sperm quality itself, that's a part of the pillars of male fertility, or it's a part of the sperm count itself, right?
Yeah. So like the other factors that we mentioned, like motility and morphology, really point to the overall quality of that sperm health. And then there's a whole bunch of other things that you can assess to understand the full quality of sperm. And what we want to do is open and have those become more readily available. So like one is DNA fragmentation to actually assess to that level. And it's important because then you can understand fully what your sperm quality is. But there's more of these different tests that you could do. And it's really exciting because now we can get a clear picture of not only sperm count, but also quality.
Mm-hmm. There was an interesting question that I saw out there, which was, do we know whether removing these environmental factors that may be causing infertility actually work, or to what degree are they effective? And I'm assuming this will require some degree of long-term studies. Like, have we been looking at that?
So I do think that there are studies being done to see, how quickly you can bounce back from certain things. Like I know for testosterone therapies, like I know that they're looking at that a lot because that's being used more and more. And so they know that that decreases sperm production, but how quickly can you bounce back once you, alleviate that or, stop taking those medications? So there are studies on things like that. As far as the lifestyle or environmental factors, it's all about, how bad it is.
Mm-hmm.
So it's kind of harder to know. They do say that if you can, weight is a problem, decreasing by 10% of your body weight, really makes a difference. You just don't see hey, if you can get rid of 10%, you'll go up by this much. Like it's so variable. So I do think that there's a lot of studies being done, but they're kind of hard questions because it's so individual. So we really like to look at the individual itself and be like, okay, from where you are doing these steps, it's going to make a difference. That's why we believe in test, do the treatment, add in the supplements, do the lifestyle changes, and then let's retest to see how it's going.
Yeah, exactly.
Is there more we need to add in? Was your exposure to these toxins just a little bit more than what we had anticipated and it's going to take a little bit longer? We really want to explain the unexplained. In fertility, that is one of the biggest things is the majority of cases are diagnosed as unexplained infertility. That is the most frustrating diagnosis
Mm-hmm.
for these patients because they want to know why. And so we're really trying to give them more of an answer there and be able to see that they are improving things as they go.
And just to add something about the environment more, because it's something that we hear more and more about what is actually impacting it. I know there's a clear evidence around pesticide and a few other things there if you're exposed to it. But the one that is getting more and more attention and people are thinking about is plastics. And so I think the research is still ongoing about it. And there's been some interesting studies. I don't know if Lendo, if you came across the recent one about microplastics being in the testicles of some patients who have passed away and like still lingering in there.
Mm-hmm.
It's a fascinating study, but I think there's more and more research there to understand the implications of microplastics. So we like to just bring as much information out there and make our patients aware of what's going on. And then they are able to, at the end of the day, make the right decision that's best for themselves. We can only recommend and give insights.
Mm-hmm.
But yeah, they definitely is important. There's a lot of things that you just don't realize. Like April was saying, like stress, sleep, huge impact as well. So there's just things that you need to think through. It's just basically being a healthy person really helps, is what I'm understanding more and more.
Yeah, the side of prevention is so important because my understanding is there's a heavy financial cost that is associated with infertility. And that's the side of things that we don't think of often, because one of the other papers that you shared with me showed how it doesn't really discriminate in between wealthy nations and poorer nations. It's very much the same. We actually had this thought. I was trying to see where I put that note. As we're doing research around this, we're realizing that, hey, we need to start having frequent conversations about fertility, because we are not going to be able to do it justice just within, however much time we have here for us.
And it has a huge impact on society if more and more of these fertility rates keep dropping. What is it right now? But most countries are below the 2% replacement number. You get South Korea that's under 1. So we need those answers. We need to start thinking more and more what's going on. How can we change that? How is sperm count and quality and overall sperm health impacting that?
Mm-hmm. Are there still things that shock you? There probably is, but is there still things that shock you or that shocked you and that left an imprint on your mind when it comes to fertility or infertility?
The one that it was the one that April mentioned, the stat there, that study where it was like 50 something percent, and then they revisited the study, I believe, and then the number got worse on total sperm count.
Mm-hmm.
I think it's roughly now 55 or 60%, they're saying, dropped since 1970. So it's getting worse and not better. And that really concerned me, because if we keep projecting out and the next time they do it, it's going to get even worse, and we're not changing that, we're not addressing it, and it's going to have huge implications on society. So that, frankly, is the one that always I come back to when I think about where we're at and what's shocking, and not enough people are talking about it.
I think for me, being that I've been on the clinical side of it, being in a clinic for so long, I think my biggest eye opener was when I talked to couples outside of the clinic going through the process of starting Hera, and really understood that most of them had seen a physician and were still looking for a solution. So the traditional path that one would take, it just isn't giving what they're looking for. It's going straight to, here, I can fix it. I can get you pregnant. Let's do artificial insemination. Let's do IVF. But they're not giving any answers. And people want to know why. Why am I not getting pregnant?
Yeah.
Not just, hey, get me pregnant. Here, let me give you my money. They want to know what happened. And I never put that together when I was in the clinic. It was just not a conversation.
That is fascinating. So people are presented solutions, which is great, but they're not being made to understand why it's happening to them.
Yeah.
I mean, everyone is doing diagnostic testing. Everyone's trying to figure it out. But when the diagnostic testing comes back and doesn't present this glaring issue, then it's just, well, we don't really know, but I bet you'll get pregnant if we do this treatment.
Yeah.
Mm-hmm.
And they still really, even if they do get pregnant doing that treatment, they still really want to know what happened.
Yeah. I think the best way I thought about this too, April, is for me, is why are we now, it feels like we're now relying on this miracle of a treatment like IVF. Because, 20, 30 years ago, people weren't able to get pregnant naturally. They're kind of left to their own devices. There's nothing they could do. And now IVF really gives them an option. And IVF really doesn't require too many, especially on the men's side, having that X number of count of sperm. And so for me, I feel like we need to come back to explaining what's going on and not just going into treating, because then people can understand, what could I do differently? What could I change? Because we should be able to get pregnant on our own. Even if you need to go through IVF, it should be that you understand why. and pretty straightforward. So I hope that changes in the next 5 years or so.
Yeah, yeah. Especially with the fact that people are having children older, and that is a fact in our society. And so you have drop in sperm count, people having children older. This whole problem of toxins within the food. YouTube has been pushing this commercial on me of this frying pan that has no forever chemicals on
I
it.
get the same thing, man. And we're probably going to get more of those now.
Right? And it seems as though it's just, some of these are just problems with how complex of a society we're becoming, the advance in technology where everything was all good. We're all excited about these new innovations just to come and find out that they harm us later on. That's why, again, these conversations are so important. Can we dive deeper into the therapies for male fertility? Spending again from what you can do at home, if I understand correctly, that's like environmental stuff. And there's still some stuff that you can get once you go to the clinic that can help you boost fertility as well.
Mm-hmm. Yeah. There are more and more treatment options available now for men. So as we mentioned, those lifestyle changes are critical. The supplements play a role, but there's medications now that you can take orally to see if it actually impacts it, especially if, and so there's like some that'll ring off, like clomiphene is a big one that more and more men are now taking, and it's still off-label use, but it's showing evidence of improving. It's probably the best of all the different types of oral medication or injectables. And then from there, there's also some certain procedures that men could take or do by a trained urologist usually that can hopefully address the issue. So varicose repair would be a big one that a lot of people end up doing after, a semen analysis and a physical assessment. So that could be one, or there's a procedure where they're extracting it from your testes. And so there are procedures like that they can do that will get you hopefully to improve what's going on with your body or get you closer to getting pregnant through like artificial, like ART. I don't know if there's any other ones that I'm missing.
So I think the only other thing that I can think of, and I mean, again, I'm not a urologist, so this is just the only other thing I saw in the IVF clinic, would be what's called a retrograde. So sometimes, this is not very common, but sometimes the sperm is actually released into the urine. So then there's nothing in the seminal fluid, but if you were to collect the urine sample right after, one had ejaculated, you can pull the sperm from that. So that would be the only other thing that I would say that I've seen.
Mm-hmm.
Yeah. And then the last thing I'll add is that there are treatments that you can do that may not address the guy's production or ability to, but will get you closer to getting the female pregnant. So one would be like IUI and intrauterine insemination, where they are collecting the sperm and then injecting it into the woman. And then that way, hopefully has a better chance getting pregnant. Or IVF, which is, getting the sperm and the egg into the lab and trying to see if it grows there and then implanting it back in. So those are other ways that if there is issues like low count, that could give you a good chance of getting pregnant. So there's so many different options to either improve your body or your body's chance of producing and having good sperm health and quality, or there's technology that can help you get to that end goal.
Mm-hmm. Mm-hmm. And kind of getting back to the cost being a barrier, if I'm understanding correctly as well, when it comes to fertility care, a lot of this is funded out of pocket for people. And so can you talk about that particular barrier, and is there any particular countries that are leading in relieving some of these barriers for people?
Well, we'll see if Trump follows through with what he said, but right now the US is not leading there. Even Canada is not leading. In Canada, they even recently in certain places, like in BC, they've added that you get a 1 cycle for free or covered, but it's still a lot of hoops that you got to jump through. Countries wise, I'm trying to think of anyone. It's probably Israel.
That's Israel.
Because I think they cover, correct me if I'm wrong, April, multiple cycles by the government. So there's no cost to the patient, maybe some on the medication, but even then it's reasonable.
And when you say multiple cycle or single cycle, can you elaborate on that a little bit?
Yeah. So multiple cycle can mean a couple of different things, because when you do a egg retrieval, doing IVF, then you can create lots of embryos depending on how many eggs you got, how much sperm you had. So once you create the embryos, you can put some back into the uterus, but then you have some left over so that you can freeze them and you can do what's called a frozen embryo transfer in the future. So one cycle can actually lead to several transfers. So it could result in, more than one child, but multiple cycles, I would consider that to be multiple retrievals. So it just, you kind of have to explain what kind of cycle you're talking about, because if you're just going off of any time you attempt pregnancy, that could be retrievals and transfers, because one retrieval could result in several transfers.
Mm-hmm. And just to understand correctly, because when we hear about this, it's mostly from the perspective of abortion and the whole debate with that. But when we're talking about reproductive care, the other side of it is also life. And so, and both of them, like clinic like yours, April, if I understand correctly, are dealing with both aspects, if that's correct. And can you elaborate on that a little bit more, the connection there? Because I think the focus is always more on one side and we don't see the flip side of it. So defunding one, like you think you're defunding or funding an abortion program, but you're also defunding or funding something, fertility, related to fertility. Is that correct?
It's all on how you define everything, right? So,
It is.
So it's about how you're defining when life occurs. It's about how you're defining what's an embryo. When do you consider it a child or a baby? So it's going to all depend on those definitions, because if you define life occurring at fertilization, then all of the embryos that are inside a lab, that would be considered in that. And so when you say you cannot destroy any of those, there are lots of those that aren't viable. And so, if you have all of these frozen embryos that maybe aren't genetically normal, they've been tested and they're not genetically normal. If you don't define things correctly, then you create a really big problem, because, I know in some previous things they were trying to define certain things that would end up, if, let's just say, a clinic in the past had an issue with a tank and the tank malfunctioned and they lost all the embryos inside. If there are 300 embryos in there, that would have been 300 counts of murder. Like, no one murdered them. Like, that was an accident and it wasn't. So it's all in how you define it. It's very complicated. And I think that's why it has been such a heated topic, is because when you're talking about abortion, you're not thinking about how that affects creating life. And that's, we're building families. We're not out here. No, none of the patients that I talk to are wanting to go get an abortion. Like, they want to be pregnant and have babies. And yet the government steps in, and if they don't define things correctly, they can interfere in their process and their right to have the family that they want.
That's very powerful. Thank you for clarifying that. That also, I had another question earlier, which was regarding the freezing of sperm. What's the idea behind that? Like, who's a candidate for that? Is it something that we do when we're younger and healthier for later, if we anticipate that we're going to have problems? Because then maybe that's where it's important to, again, figure out early if we get any indications that we may have a problem.
So the majority of the people that are taking advantage of fertility preservation is people who have been diagnosed with cancer, people who are going to undergo any kind of hormone treatment, that'll affect sperm production. People with certain diseases that could lead to a treatment that could cause sterility. And we've even had a lot of soldiers before they ship out wanting to go ahead and freeze sperm. So there's a lot of different reasons to utilize something like that. If you know you need testosterone therapy and you know it's going to cause an issue with your sperm production, you may want to go ahead and freeze some sperm. So there's really a lot of reasons to do it. Maybe you don't want to have children until you're much, much older. Age is a little bit less of a factor that is thought of for men, but it is a factor. Age does decline men's fertility, maybe not as dramatically as women's, but it is something to think about.
The one thing I'll add to it as well is that it's just a great way to now just have a backup plan and be, especially on the sperm freezing side, if something happens, at least you have that and you're able to have kids or have a good shot too. So I think especially now, we're finding that more and more people are considering it and going with it. It's great to have these kind of different options.
Absolutely. Earlier, there's the part that fascinated me really was, and just from a biological standpoint, was how the male who suffer from infertility also carry more disease burdens. Essentially, they're predisposed to more diseases or...
Yeah, I think there's more and more research coming out about the correlation between male infertility and other conditions. And that's what really fascinates us, is that there is a biomarker that has been under researched and undervalued that could correlate or give a better idea on, let's say, prostate health and prostate cancer, or it can go beyond and just overall men's health. And so I think there's a huge potential there. And why aren't we using it for that full potential? And I think that's what's really exciting. So I think probably in the next couple of years, we're going to see more and more of that come out and show that, hey, you can actually use sperm health maybe to be better at finding prostate cancer or other cancers. And that's exciting because I think more to us on prevention. Wouldn't it be great to do a sperm test every year, part of your physical, and understand what are your risks, what's going on, and not just look at it as purely for fertility, and change it so that it's really about sperm health and overall health.
Are there any such ideas that are coming about with clinicians when you present to them your solution with home testing kit? Is that some of the things that they're thinking about?
I would say prostate health is probably the one that comes up more often than not, and probably the more research. I don't know, April, have you heard of others?
Yeah, I mean, I've heard from a few about, heart disease is another thing, and diabetes is really, it's also, really on the forefront of everyone's minds right now. So I would say those are the main ones.
Okay. Are there any aspects of fertility care that you're looking forward to in terms of whether it's just more in the field of innovation, more in the field of technology, more in the field of awareness and prevention? If you can kind of like...
For me, and I think for us here at Hera, the big thing that we are really excited about is how can we change or reimagine how testing and treatment happens with male infertility. So I'm really excited on how can we evolve the testing so that we can uncover more about sperm health. Because I think the more information we get, the more accurate, the more precise, all of that, we can really tackle these issues that people are facing. And that's what really I'm excited about right now. And then from there, potentially bring up and find out and uncover other conditions that potentially could be happening. And really get a good idea of what's going on with this person and their health. So I think that the testing one for sure for me is really exciting. April.
I mean, I think for me, it's really exciting to bring the guy into the fertility journey a lot sooner. I think that the infertility journey has been really difficult for women. Feeling alone trying to figure out, what's going on with me and taking on that burden by themselves. And then him coming in so much later. I think what I heard most was from the point of view of the male partner, he wanted to help, but didn't know how and didn't know what his role in this was. And so I'm really excited about bringing him in earlier so that they can walk through this together. Because, unfortunately, couples that go through fertility journeys like this, have a really high rate of separating. And so I really think that being able to get them both on the same page and supporting each other through the whole thing is really going to help change that narrative because, we're building families. We're not trying to break them up. So, So yeah, I think it's really important for the couple to get through this and build a strong family on the other side.
Yeah. What more can be done to address the traumatic aspect of that when you're talking about relationships breaking up as a result of this, people never trying again? Even I'm sure sometimes people may have that finally conceive and they're like, we're done. We're not, this was too much effort. This was too much. We don't want to go through this again. What can be done or what is being done to address that traumatic aspect of what people go through?
Yeah, I think the important thing through this is communication. And I think that's what I heard in all of the different interviews and people that I talked to is, she doesn't know how to talk to him about what she needs from him. And he doesn't know how to talk to her because no one is wanting to make the other one feel bad. And I think really having that communication and understanding we're going through this together. It's not on me. It's not on you. I've got my stuff to do. You've got yours. We're going to figure this out and we're going to do this together and talk about it every step of the way. I really think that's going to help. And I think the communication has been so divided because she's going through her part first and then he gets pulled in. And I think that it'll be easier to communicate about all of it if they are doing it together from the beginning.
That is so amazing. And I think we've touched base on this just a tiny bit couple minutes ago, but what are clinicians' thoughts when you first present them? Like, hey, people can start testing at home early. What has been the journey like to try and integrate this into clinics, and what ideas are coming about with this here? Because I feel like there's so many opportunities within this field, especially even just having more conversations about it. Now we're opening up this whole can of worm in terms of prevention and what you can do at home or what you can do early on. What are there like little light bulb moments that are going up with some of the clinicians that you present this technology to?
I remember one moment recently with a women's clinic where they're seeing countless patients come in, and there was that light bulb moment where they saw the true potential here, where they can finally get the guy tested and get the information that they need so they can provide the good care that and the treatment that they want to do. Because now they can easily just hand it to that person and be like, give it to your partner. So I think that clinicians really see that this could be a game changer and really help them. And that's really important for us. We don't want to replace any relationship that a patient is having with the clinician or how they are working with the health system. We want to be a part of it. We want to be the piece. So that's why it's super important for us to get that buy-in from the clinician, their trust and their respect on the quality of our program. And so, yeah, when I see that, I know that there is that moment, and that's important because then they'll order and they'll use it and they'll find it valuable.
Mm-hmm.
Yeah, I think there was a family doc that I was having a conversation with. It was just in this moment of if they want to have a baby, I just send them to the fertility clinic. Like, I don't know. I don't know when I should. I don't know what I should be getting in advance. And so being able to say, well, this is great because if they're saying they even want to start a family, go ahead and get them tested, because if it comes back and there's any issues, now you can, with confidence, get them to the fertility clinic before they wasted that year.
Mm-hmm.
That's what they were doing. They were following the guidelines of the infertility diagnosis, saying, well, I can't send you to a fertility clinic until you've been trying for over a year. if he has a low sperm count or an issue with quality, you can send them much sooner. And so then they're able to get the help they need a lot sooner. They're not as frustrated. They're a much better experience for the patient, and the clinics are being brought in at a better time than the current, process of getting frustrated patients that have already gone through so much.
Mm-hmm. Is there, and I'm sure there's logistics behind this that can mitigate costs, but especially once you guys are producing at greater scales, what about like the cost of it? Like, was it a costly thing for this testing process to be also done in the hospital? Are we relieving a certain cost element by doing it at home as well? And there has to be, because if we're taking up more time in the hospitals, more visitations, hospitals and clinics are already crowded. We know that.
Yeah, no, it's an important piece because cost plays a big role in overall access and getting people to use it. Right now, we're at cost to what they would spend at a hospital or a lot of these different places. But our goal is to bring that cost down more and more and to get it covered. That way it becomes fully accessible and it becomes a no-brainer for everyone. And it's not just for people who can afford it. So that's a big goal and big focus for us. And, as a startup, it's going to require a lot of brain power and resources to think through, figure out how do we do that without disrupting quality. But on top of that, we're also bringing new innovations that may uncover things and hopefully prevent additional costs. What if our way allows more and more people to get pregnant without IVF and therefore not spend the $10, $20, maybe $40,000 that they would with IVF? So our goal is to really make it super, super accessible in multiple ways.
Amazing. No, thank you so much. We've covered a lot of ground with this conversation here. I'm so happy we had the opportunity to do this. Is there anything that we've missed or any closing remarks on your part? Even let us know what's ahead and what's ahead for Hera Fertility and where people can find out more about your work and your product.
I thank you for allowing us to do this. This has been awesome, a lot of fun. I think, number one, you can check us out on herafertility.co. You can get our products there and services. But also, feel free to reach out to either one of us anytime if you have questions. A lot of times we're answering these kind of questions and supporting people because this is a journey. This isn't something that just happens the next day. You got to be prepared, and we're here to help. And we're able to answer questions that you may have, both men and women wise. But yeah, I just want to say that this has been awesome and I love what you guys are doing. When I first heard about a podcast and that was named Super Daddy Club, I was like, what is this? What is this about? And realizing that you guys are bringing stories that normally aren't talked about and shining a light on dads and fatherhood and all that, I think is so important. So I really appreciate you guys having us and doing podcasts like this.
Absolutely. Thank you. April, any closing remarks on your end?
I'm just happy to be able to speak about this. I absolutely love what I do. And, we are always here to talk no matter what. So yeah, any chance that I have to really raise awareness about this and get people talking about fertility on both the male and female side, I just appreciate it.
And on our end, I absolutely expect us to have more episodes on this topic because, like I said earlier, there's just so many angles to tackle it from. And even having a urologist come in and see, what their perspective has been.
Yeah. We'll be happy to help in any way there. We have a bunch of urologists that we work with that advise us, that see patients. I think that would be awesome to maybe even not even just talk about male fertility, but men's health in general.
Absolutely. I always think about how when we started this platform, we thought we're just going to be talking about men navigating the family court system. And here we are, in a completely different field. So it's also been an amazing journey for us. But I thank you enormously for taking the time to have this conversation with us and all the insight that you've brought forward. I wish you all the best with everything that you're doing forward. And yeah, if there's any more way we can work together to bring more information to people, please, let's do it. Yeah.
Great.
For sure. No, thank you for this.
Absolutely, absolutely. Well, there you have it, folks. We wish you all an amazing day, amazing rest of your week, and we'll see you on the next one on the Super Daddy Club podcast. Thank you.
Thank you.
That was great.
Yeah.